All right, this is Chris from the Obstacle Doc, and today we're going to talk about self-ankle mobilization strategies that you can do at home to complement the manual therapy that we do in your treatment sessions. The reason why this is important is oftentimes when anybody is immobilized, say in a boot, for really any amount of time over a week, say 2 weeks, 4 weeks, a few months, a lot of times our ankle joint gets stiff. It's almost like walking on a brick. So we need to kind of open that up, loosen that up. That way we can normalize our stride for walking, for stairs, for squatting, and even for running and sport movements as well. This can also happen in non-immobilization periods of like an ankle sprain, where often we think about an ankle sprain being unstable in and out, but we actually lose motion going forward, which can be a critical puzzle piece that oftentimes plagues people who have ankle sprains that don't really ever get better, or it takes a long time to really get over the hill. And oftentimes, once we clinically look at this, we notice that they lack motion going forward in their ankle. So how to do this on your own is the following. What you're gonna need is a band, something that you can anchor around, and a step stool or a box. The higher, in a way, the better to a degree, because we have to create a gradient with the band so that the band doesn't move out of position. So to set up the following, we're gonna mobilize Daniela's right ankle. So I have this fixated behind her. I'm gonna take the band, loop it through her foot. Now the critical piece is we have two bony bumps on the inside and outside of our ankle. They are our malleolus on the outside and inside, coming from the long bones down in the lower leg. The band needs to hook underneath them so that it actually gets inside where your ankle joint resides. If it's above, it's not going to be technically as good. So we want to make sure that they're sitting below. That is also going to kind of dictate the height of this box. If this is too low, a lot of times it's going to snap above. So again, we want to pick a height that we can get into position with, but also that creates that proper gradient. Now that we have her set up, Daniela is going to keep her hips forward, and as best as she can, she is going to actively move her knee in front of her over her toes with the intention of keeping her heel down. The band is going to have an appropriate amount of stretch tension, so you want to pull your system away from your anchor enough to feel like this is actually pulling backwards. If it's too loose, it's not going to be as effective to mobilize that joint. What you want to think about is this is actually acting as a catalyst to facilitate proper joint motion inside her ankle as she dorsiflex or comes forward. So think of it like we're kind of putting some WD-40 in a rusty door hinge, and every time she moves forward, we're creating more joint motion. Options that we can consider with this is we can work angles. So as Daniela comes forward, she can direct her knee inward and back out. She can direct her knee outward and back, and again, straight ahead. If you're having a hard time with balancing, you can always hold on to something, so don't make life harder for you as you're doing it. Now, a nice breakout from this exercise is someone's having, say, for example, ankle stiffness or pain or pinching, or they can't keep their heel down when they're squatting. We can take the box away. We can have Daniela put herself in her squat stance position. Again, we want to maintain our proper position of the band below the ankle bone. So again, you'd have to kind of put this in a proper line. And she's going to go into her squat while this is pulling back. For patients who run into themselves or lack motion, this is a great way to self-mobilize while you're doing a functional movement such as a squat. In the short term, it can be used as an intervention strategy to squat and to promote the proper ankle mobility that you would need. All right, another ankle mobilization strategy that does require another band as well as potentially a partner, but it can be doubly effective because we're moving the joint in both directions at the same time, is the following setup. So Daniela is going to place her foot on top. One band's going to come from the front. The other band is going to come from behind. The setup is very similar. One band is going to go below the malleoli on either side. appropriate stretch going backwards. The other band is going to come above them. And again, with an appropriate stretch coming forward. So either your partner is pulling for you while the other one is pulling backwards, or if you're creative enough at your home that you can actually get 2 anchored setups, even better. And again, she's going to do the exact same strategy as she comes forward. Now we're getting mobilization from back to front with this black band, and we're also getting mobilization from forward to back with the orange band. She can come forward. She can also go in our different quadrants, again, trying to loosen up that ankle. In terms of treatment prescription, we usually discuss mobilizing for a period of about 30 to 60 seconds, relaxing and repeating at least 3 or 4 times in one setting. The goal is to try to see if you can achieve more motion. We are not trying to make anything painful or cause any sharp pain, but with that being said, we are working with stiffness. So we do need to go into that little bit of that stretch, tension, discomfort, or else we're not chipping away at it. This can be done daily, potentially even multiple times a day if this is one of your primary impairments in terms of getting that mobility back for your walking stride, your running, your stairs, et cetera.